Definition: Semisolids. Products of semisolid consistency mainly used topically. Types of semisolids: ointment base, emulsion, geometric solution, creams, emulsions, geometric dilution, pastes, high solid content, toothpaste, gel, polymer, gum, methyl cellulose, poultices, plasters. Not a medication for it. Ideal properties: physical property, therapeutic or physiological considerations, properties for its use, application. Physical property: texture smooth, hydrating to skin, 8 emollient base ointment for better absorption, non-gritty, non-greasy, no staining, non-hygroscopic so they don't absorb moisture from air environment, degrade drugs if absorbs. Therapeutic or physiological considerations: non-irritating to skin. Properties for its use, application. Easy apply, spread, efficient drug release, washable, aqueous in nature, aqueous skin secretion is aqueous. Advantages of semisolid: topical and local effect, affected area bypass, first pass metabolism, blood circulation, convenient for unconscious PT, substitute for bitter drug, more stable than liquid, less stable than solid. Disadvantages of semisolid: staining, bulky PT, allergies, less stable than solid. Semisolid bases and their selection considerations: ointment base, H cream base, cream pastes, oint based gels, polymer. Ointment: hydrocarbon based. Cream: emulsion system with opaque appearance, texture depends on with O or OW. Pastes: high percentage ointments with insoluble solid, stiff texture because high amount of particular matter. Gels: polymeric matrix, smooth, transparent, translucent, non-greasy. Skin: 20 layers, 0.5 mm thick, main barrier of absorption. Skin functions: temp regulator, sensory excretion, vitese synthesis, protection, moisture and blood storage. Skin facts: largest organ, protective barrier, thickness, palm greater than soles, greater than rest of body, greater than eyelid. Structure of skin: epidermis, stratum corneum, dermis, sweat gland, hair follicle, blood vessel, subcutaneous. Epidermis: drug has to go past the stratum corneum to the new cells. Drug absorbed by 3 routes. 1. Transepidermal penetration. 2. Transapendagal penetration. Transepidermal penetration. Paracellular intracellular penetration. Drug is water-soluble. Transcellular/intercellular drug is lipid oil-soluble drug, pass through cell membrane. Maximum absorption by transcellular or paracellular route. Transcellular, also known as intercellular. Paracellular, also known as intracellular. Transapendagal penetration, also known as appendage. Transcellular, also known as intercellular. Transapendagal penetration or appendage penetration. Straight to capillary. Water-soluble. Small absorption. Lipid oil. More absorption. Can you apply topical to open wound? No, because there is no skin for absorption. Dry skin. Less absorption. Moisturized skin. More absorption. Molecular weight of drug can't be more than 600 Dalton. Effective vehicle can affect drug release gel faster than paste emollient used for dry skin. pH skin is slightly acidic, so acidic drug. Bases. Most important ingredient used in formulation for semi-solid dosage form. Type of bases. Oleaginous bases, absorption bases, emulsion bases, water-soluble bases. Ideal properties of the base. Inert, non-irritating, non-sensitizing. Preservative commonly used for topical application. Methyl hydroxybenzopropyl hydroxybenzochloricrysol benzoic acid phenylmercuric nitrate. Antioxidants. Removing free radical with BHT, mainly used for oil system reducing agent, lower redox potential than drug. Ascorbic acid, mainly used aqueous creams. Gelling agent. Forms gels, liquid as color dissolving, weak cohesion cellulose derivatives, and carbomer 941 carbomer synthetic polymer. Which has the most viscosity, carbomer 941 or methyl cellulose. Methyl cellulose. Permeation enhancer. To help bypass the skin barrier, X-Diclofenac gel. Emulsifier. Stabilizes an emulsion to increase its kinetic stability. Surface active substances or surfactants. Humectant. Skin hydration hygroscopic substance, hydroxyl groups. Buffer. Compatibility with skin, drug solubility, stability, ionization of drug. Manufacturing procedure, evaluation and packaging. Physical methods, microbiological methods. Physical methods, rate of absorption. Rub on skin and take sample. Pharmacokinetic profile, mcg/ml. Analytical methods or drug analysis to measure drug in formulation. If drug DOESNT appear in sample, then it WASNT. Absorb therapeutic window 24 hours. Physical methods, non-irritancy. Patch test, no visible reaction or erythema. Physical methods, rate penetration. Microdialysis method, analyzing aliquots using spectrophotometer. Physical methods, test drug release. Test tube, buffer and add serum or saline. Measure saline for QT of drug use, EHP. Physical methods, rheological. Use cone and plate viscometer for viscosity of preparation. Microbiological methods, test of microbial content. Different samples, collect and incubate. Look for clots formation. No clots equals no microorganisms. Microbiological methods, preservative efficacy. Tryptone azolectin broth, pour plate counted on days 7, 14, 21, 28 to see how good is it for. Selection of semi-solid dosage form. Type of skin lesions, dry, broken skin. Ointment versus cream. Ointment for dry skin and stick longer, cream will melt quickly, immediate effect. Quality control. Raw material specification needs to be of highest quality and purity. Physical description. Main test for identification of material. Identity infrared spectroscopy for purity HPM. Finished product test. Microbial test, physical test. Packaging must not be reactive, additive, absorptive, be exact to identity, strength, purity of drug will not be affected. Definition: Semisolids.